Licensed vocational nurses actually came from the idea that whenever there's an increased need for RNs and there's a shortage of RNs, they came about the need for an assistant for an RN.
IME's 11-month program is accelerated and lets you get into the job market sooner.
So in an LVN program, there's two parts to it. There's a lecture part, which basically is the medications, which is pharmacology, the pathophysiology of the diseases, and then in the clinical part is basically doing the medication administration, how to do certain procedures like dressing a wound, giving injections for diabetes patients, or auscultating lungs. So 110 over 80.
So primarily they provide basic skilled nursing, which anything from basic comfort and care to managing pain, to managing the basic physical needs that a person might have in times of chronic illness.
I'm learning how to take care of patients, both older people and young people, how to, administer their medications, and understanding the medications and how they work in the body. Actually, that's very interesting.
Yeah, we have a lot of fun. Everybody, when you're in the program, you just bond with certain people, and they're basically your family for the next 12 months.
When somebody has a heart problem, EKG helps you to see how the heart is functioning.
I picked IME's program because I looked around. Most of them take 2 to 3 years, and IME's 13-month program is pretty fast and efficient.
I like it. I like to come every day in the morning, because I see the students and the teachers, and I like the environment.
Since I got into it, I like it a lot, and I wouldn't pass it on for anything.
The instructors are great. They're always there to help you, and once you start falling behind, they get you to the side and they want to talk to you and ask you why you're going down and try to help you out.
The way the class is scheduled fits people like me so much. You can come in first thing in the morning, like 9 to 1.
Students here pretty much they go to class 4 hours a day. So they still have the opportunity to work full-time while going to school.
An LVN is someone who has a place in the community. They care about the people that they're taking care of.
Just the fact that you're going to make a difference in somebody's life.
It requires someone who has a good heart, who has a great instinct to identify the needs of their client. And when I say needs, it just doesn't limit it to the physical needs, but more even psychosocial, spiritual needs of the client in general.
It's very important that you get satisfaction from helping other people and that you pay attention to detail. Details can sometimes make the difference between life and death with some of these patients. To be a student at IME, you have to be a high school graduate, and when you complete the course, you must take a state-approved NCLEX examination.
Well, the NCLEX is basically an exam which composes of all the skills you've learned in nursing school. It's just the basic level, so you don't got to be a genius, just at the level where you can pass it.
We are actually one of the few schools I know of in the Bay Area that actually does the online testing, and the effort for that is to simulate the actual board exams early on, to kind of integrate that into their culture right away.
The job is virtually recession-proof. It's the only sector of the economy that is still growing.
Okay, IME provides financial aid, and I had a great experience because they gave me some grants, and then as well they offer loans.
So I encourage you to come see us and visit us at IME so we can show you what kind of opportunity you might have in the learning environment that we foster, which is continuous growth. Thank you once again, and we look forward to seeing you at IME.